Hello, and welcome everyone, and thank you for coming. My name is Jeremy Burton, and I am the Executive Director of the Jewish Community Relations Council of Greater Boston, and we're happy to have you all joining us here today. As a reminder, for those of you who've been with us before, there will be time for questions following the beginning of our conversation today. The Q&A function here is available to you at the bottom of your screen to submit any questions for Senator Rausch. And I will remind you again about that as we go on with the program. So I'm very thrilled to introduce and be joined by a friend personally and of JCRC today to have a conversation. Formal session on Beacon Hill is just coming to an end. And Senator Rausch, who has been a champion of so many issues of interest to our community and to the Commonwealth, has just been somebody I've enjoyed my conversations with, and I hope that you will enjoy this as well. Senator Becca Rausch, by way of introduction, was first elected in 2018, and she has been an effective agent of positive change in the Massachusetts legislature since then. She is the third woman, the second Democrat, and the first Jewish person to represent the Norfolk, Bristol, and Middlesex district in the Senate. Now in her second term, Senator Rausch is the Senate chairperson of the Joint Committee on the Environment, Natural Resources, and Agriculture, Senate Vice Chair of the Joint Committee on State Administration and Regulatory Oversight, a member of the Joint Committees on Children, Families, and Persons with Disabilities, Public Health, Public Safety, Revenue, and Community Development and Small Business. Early in her tenure, Senator Rausch was appointed by Senate President Spilka to serve on the Senate's Temporary Committee on Rules, an honor that is rarely earned by first-term legislators. She also serves on the board of directors for the National Association of Jewish Legislators, NAJL. You can read Senator Rausch's full bio in our website and in the chat. Senator Rausch, I invite you to turn on your camera and your mic, and to thank you for joining us today. And I'd like to start by asking you to tell us a bit about your journey as a Jewish leader. I think some things that maybe I'm familiar with, but many of other members of our community don't know about you, particularly outside of your district. A little bit about the community you grew up in, how you came to be involved in politics and public life, and maybe a little bit about what it's like to serve as a Jewish leader in public office. Senator.
Thank you so much, Jeremy. It's a pleasure and a privilege to be here with you. And thank you to everyone who's tuning in today. How did I get here? What a good question. I was raised in a Jewish home. I am second generation on my American on my maternal grandfather's side. My grandfather was a survivor of the Holocaust. My mother worked in my youth, founded a nonprofit specifically designed to help locate and prosecute Nazi war criminals. So my family history and my mother's work certainly influenced me as a child, and as I look back on it, certainly as an adult. My Jewish values are really rooted in education and health and equity and democracy, and combating discrimination. Although never in a million years did I ever think I was going into politics. And yet here we are. But one thing led to another, and I'll spare the details of all of that. But as a lawyer by training, with training specifically and expertise in healthcare and data privacy and information governance and discrimination, landing in the Senate when I first decided to run, and my family and close friends said, "Oh, of course you're doing that." And I said, "I wish someone would have given me the memo. That would have been great." And now that I'm here, especially as I look back in my first run in 2018, I came to realize that a very specific instance of very targeted anti-Semitism at me in my years in high school really served as a really pivotal moment in my life, and kind of set me on this path of being an agent of positive social change. It's why I went to law school. But again, never thought I would be using that training as a lawmaker. But now that I'm here, I'm really, really grateful to be able to serve in this capacity, to serve nationally in this capacity as a leader on the board of NAGIL, as you said in that wonderful and warm introduction. And also to bring some of the cultural aspects of my Jewish identity to the legislature. For example, I am a longtime avid Israeli dancer and an internationally acclaimed Israeli dance performer and choreographer, which of course I don't have much time to do now because I have just a couple of other things to do. But
I'm sorry I didn't include that in the intro bio.
It doesn't usually make it into the bios, but it is, something that I grew up with, something that I have loved my whole life. It's a wonderful way to come together in community, get a little exercise. Certainly something that I could use a little more of these days as we all try to navigate our way, continuing through this pandemic period. But it's a constant source of strength for me to come back to my Jewish values in the moment when legislating gets difficult.
Well, thank you. I guess maybe we'll start with some of the substance that you've been working on, but I want to come back to that sort of like your Jewish values and anti-Semitism. But I know we don't want to spend the entire time talking about that today.
Sure.
But maybe this is going to quickly lead us into that, because I know one of the issues that you have been passionate about, and frankly, we've been passionate about in support of your legislative leadership, has been vaccination. And this is something that, for some folks here will not realize this, but like, while vaccination is very much in the news right now, vaccination is an issue you've been leading on even before the pandemic. And, you took on the issue of childhood vaccination in Massachusetts. You co-sponsored legislation to promote accurate information about vaccines, to boost rates across the Commonwealth, build a robust infrastructure for tracking rates. And I remember you coming to us a few years ago and asking us to endorse legislation that you were working on, and our council met and considered it and ended up doing so. And so, like, I know this is something we've been in the trenches a bit on for several years, and I was like pre-pandemic. So I guess, like, it's easy to talk about everybody's paying attention to vaccination now, but given this is an issue you've been a part of for a long time, to maybe talk about what prompted your focus on this issue at a time that it really wasn't something that was a matter of public awareness in the way it is.
Yeah. It's true. It feels like eons ago that I first wrote that bill. But I started working on, as I mentioned earlier, I'm a healthcare attorney by training. And when my husband and I are very lucky to have 2 children. And when our oldest was in his first year of life, there was a measles outbreak. And this is long before I thought about running for office. But I, quickly went to my pediatrician and said, what's going on? This is terrifying. Can my child get a vaccine? And he was too young to get the measles vaccine. But measles was running around the community. And there was nothing either of us could do as parents to protect our child by way of vaccination. And then when I was elected to the Senate in the sort of lead up, after my election, before I was actually sworn in, I said, hey, I wonder what actually is going on with our law, right? What is our law around school vaccination and preschools, summer camps, all these youth programs. And I looked at it through the eyes of not just a parent who had been through a very concerning time when I did not have vaccination available to protect my child, but also through the eyes of a healthcare attorney who now is about to take an oath of office to uphold the Constitution and protect the health and safety of 175,000 people in my district and millions of people across the Commonwealth. And I looked at it and I said, my God, it's terrible in here, right? It is a hodgepodge of statutes at best. It is Swiss cheese. We do not have in Massachusetts of all places, right? The first state in the nation to require a smallpox vaccine, way back hundreds of years ago, how far we've slipped. We don't even have a consistent, one cohesive place to go in our statutory law to find all of the rules about youth program vaccination requirements or youth program exemption requirements. It just doesn't exist. There's a bunch of different pieces that are kind of chopped up in different places in our statutory text that has led to a variety of additional statutes being enacted and other proposals coming in and out at various times, some of which have been, intended to go one way and ended up, going in a completely different way because we're just so sorely lacking strong statutes when it comes to immunization infrastructure. And so that's what I set out to do. I said, I can do this, right? I am a healthcare attorney by training. I have experience working in the administrative branch. Right before I was elected to the Senate, I was actually an attorney, a secretariat level attorney at the Executive Office of Health and Human Services in both the Patrick and the Baker administrations. So, and I had practiced in the private sector in health law as well, and been a health law professor, right? So I thought, this is a place where I can really make game-changing, life-saving change. And that's exactly what the people who helped me get elected and the people who voted for me now several times sent me to Beacon Hill to do and to keep doing. So I wrote this Community Immunity Act with my team and dozens of experts in public health and science to really shore up the infrastructure around vaccination in our youth programs, because that's when most of our vaccines come in, present time notwithstanding, right? So, make sure we have consistent and centralized, standardized requirements for vaccines and vaccination exemptions, making sure that we actually get a complete set of data. This was one of the most mind-blowing pieces as we did the research. We don't even have a complete data set on youth vaccination rates throughout the Commonwealth. Our data set is only about 80% complete. And the reason for that is because our laws, right, the laws that we have on the books don't give DPH the authority to actually do that on a mandatory basis, right, to get the rates in each and every youth program throughout the state. So they put out a voluntary survey every year, and that gets roughly 4 out of 5, programs responding, which to a voluntary survey is a pretty good rate. But when it comes to vaccines, it's just an insufficient, incomplete data set. So we got to get all the data. We got to have consistent, standardized, and centralized processes and protocols around vaccination requirements and vaccination exemptions. And you can see that the lack of that has led to gross disparities along all the lines that you might think those disparities exist, right? Particularly around socioeconomic and racial equity lines. And you can see it in the data in terms of where we have strong vaccination implementation and where it has just kind of fallen apart. And we also put in what most important, or one of the most important pieces is this education and outreach component to make sure that we're getting accurate, trusted information out to people in communities at elevated risk for the spread of vaccine preventable illness, because they've lost that herd immunity. And a lot of communities have. It would blow your mind to see some of these maps. But we've got to get information out, not only about vaccine safety and efficacy, but also about accessibility, right? We have a vaccine trust fund in Massachusetts that will pay for every single vaccination. And that's funded not by tax dollars, but by the insurance companies. So, we have a lot of really strong resources that if we just added the infrastructure, we could really shore it up. And so I wrote and filed that bill in 2019, long before COVID hit, long before PPE, was a household term, before we all started living in this pandemic world. But we're now literally living through the consequences of having failed infrastructure on public health and vaccines, and also no herd immunity against a rampant, deadly virus. So we've got work to do, and I'm so grateful to partner with you and NAMI and others at JCRC and more than 20, religiously affiliated public health, medical, educational organizations all throughout the state to get this over the finish line.
Well, we are, as I said, very, very proud to be part of this work with you, and it's proud to be a voice of a community that is in part a faith community on Beacon Hill. And I know we're going to talk a little later, maybe specifically, you mentioned Nami Nadich, our deputy director, who testified in a hearing a few weeks ago. I think we may talk about that hearing in a few minutes, but before we get there, maybe let's talk more specifically. Obviously, I'm listening to you talk about this and your passion around this issue, and recognizing that the language and the words you're using are now familiar to the rest of us. But when you first came and talked with us about this 2 years ago, honestly, I had no idea half the words you just said. So like, I'm sort of, I'm interested in like digging in a little deeper into sort of the work you've been doing now, not only on this pre-COVID work, but on the Vaccine Equity Act during COVID. And sure. If there are any specific issues unique to COVID that have been coming up, I'm curious like what they are, and maybe if you can tell us a little bit about uniquely or specifically how the work you've been doing on vaccination has pivoted, to use the word we've used too much, into like the COVID related Vaccine Equity Act.
Yeah. It's been blatantly obvious for a really long time, pretty much since the outset of COVID, that we have an equity problem, right? And that's not unique to COVID, as there's so many places where our social safety nets and government structures have just utterly failed some people in our Commonwealth, while disproportionately lifting up others. And it became very clear very fast that COVID was impacting communities of color, low-income communities, immigrant communities, vastly more than communities with more financial resources, predominantly white communities, communities where people had the privilege of being able to work from home rather than going into work. And that was something that I knew would come even before COVID really hit. Right, it's something that I anticipated in the public health hearing that we held. I think it was February of 2020. It was just before the shutdown. And I have such vivid memory of Senator Comerford leading that hearing and me sitting there and asking questions and drilling in, are we prepared for this? Do we have the resources? What's coming? And we all thought, we're going to have to shut down for 2 weeks. And here we are a year and a half later. So the COVID Vaccine Equity Act came to be really the basis of that bill started even before that hearing, but certainly started coming into fruition more along the lines of that hearing. And as COVID really took such a strong hold on all of us, and we started to see the gross disparities in impact of the disease. And then of course the vaccines came and we saw yet more gross disparities and inequities in the way the vaccination rollout unfolded. So that bill was a really strongly collaborative effort. I was very proud to file it with a great team in the House and the Senate, right? Senator Sonia Chang Diaz, Rep. Liz Miranda, and Rep. Mindy Dom. The 4 of us have filed that bill with help from Senator Comerford, that basically picked up on all of the pieces that we all wished the administration had just done without us pushing him. Right, mobile vaccination units, tracking the data, right? We did in fact have a data equity, a COVID data equity bill that the legislature passed and pushed, and the governor did sign into law back in June of 2020, which by the way, the administration has now ceased to comply with, because they are no longer publishing equity-focused data on COVID hospitalizations. And that's just gone. They just stopped doing it, which violates that law that the governor himself signed. So there are a number of pieces of the COVID Vaccine Equity Act that that the administration did eventually over time start to pick up, not done in the way that I would necessarily do it. But we still, for example, don't have a director of vaccination equity, right? And that is a hugely important role, not just for COVID, but for every infectious disease throughout the state, right? Throughout our medical history, right? And a lot of that work, did, for me at least, find its roots in so much of my professional history. Certainly in the deep work that we did on the Community Immunity Act to get that up and filed the first time. And you're right, we had to do a lot of educating the first time around when we had this bill filed initially in, if memory serves, it was September of 2019. About what herd immunity is, right? What is herd immunity? Why is it so important that we have herd immunity? And, and what do we do, right? And that's like such a function of, people in my generation, because we've really grown up with the exception of a number of outbreaks, and those are quite scary, but we didn't grow up with polio, right? We grew up after measles vaccination was available. We haven't really seen this until now. So it's I wasn't trying to be omniscient, but or prescient, but here we are.
I definitely agree with you that our generation, there are certain things we just sort of assumed that have been somewhat shattered by the last year and a half. And I think this is one of those areas of having to learn some things about public health that frankly we took for granted in our generation and had not had to deal with in this way. There are questions starting to come in through the Q&A, and I want to encourage, we have a large audience, and to encourage people, the Q&A function is at the bottom of your screen, and I'm looking forward to getting to a few of them in a few minutes. But since we are talking about your vaccination equity legislation and some of this work, and I had referenced a hearing a few weeks ago, this maybe also brings us back a little bit to the intro and you as a Jewish leader in public life, which is something we've talked a lot about in our own private relationship. Let's just be honest about it. Like we have seen, I was just watching, there's stuff going on this weekend in Oklahoma. I saw this weekend that national Jewish organizations have been speaking out about where, leaders in Oklahoma public life, and it's not the first place, it just happened to be this weekend, are like literally using the Star of David, the yellow star that was used by the Nazis, and they're using that as part of a campaign against vaccination. And we've seen this phenomenon a lot this year of anti-vaxxers across the country, and I want to bring it back to, and here in Massachusetts, using deeply offensive comparisons between vaccination requirements and the Holocaust. And I think many of us would characterize those framings and usages as anti-Semitic. And even if one doesn't say they are anti-Semitic, they are certainly, in a much more troubling way, a minimization of the meaning and significance of the Holocaust as a unique event. And, in that sense of that, saying that what happened with Jews literally be taken to the death camps is somehow akin to being required or even, asked to do something like masking up. So I want to ask you, because this came up clearly in a hearing a couple of weeks ago. We saw this, at a hearing where our deputy director testified on behalf of JCRC in support of this legislation. You certainly experienced this, I know, in some of the communications you've received. So as a Jewish legislator who's been so prominently associated with this issue, what's this been like for you this particular period, leading on this particular set of issues? And are there candidly other instances of anti-Semitism that you've observed and experienced in your time in public leadership now over the last 3 years that maybe you could share or provide some insight to our audience today?
It's always difficult to talk about, so bear with me here. So first of all, let's start with the hearing. I anticipated that anti-Semitism would arise throughout the duration of the anti-vax propaganda hurled at the Public Health Committee, a fair portion of which was directed specifically at me. But I feel compelled to say that NAMI was, our JCRC's associate director was the only person testifying in favor of the bill, or actually in favor of the bill. I'll stick with that. Who prominently identified as Jewish. And she was the only person who the opposition muted and booted out of the virtual hearing during her live testimony. That's not coincidence to me. That's anti-Semitism, coupled with more false equivalencies than I can count between vaccination infrastructure and the Holocaust. And it's particularly difficult to hear as the granddaughter of a survivor. As someone who only learned much later in life, when I was finally able to travel to Germany, as an adult, as a parent already, it wasn't until that time when I was actually able to go to the city where my roots are, where some of my roots are, ancestrally, and learn that I had a great grandfather who was a politician in Augsburg in Germany before the war. I had no idea. I wish I could say I was surprised by what happened during that hearing, but I'm not. I was prepared for it, and I knew it would come. And part of why I knew it would come is because of what happened in the hearing in 2019, where a blonde-haired, blue-eyed young girl looked me straight in the face and said, "I'm an unvaccinated child. What should I do? Start walking around school wearing a yellow star?" In the public hearing, very much toward the end of a nearly 13-hour hearing. And, and I chose not to say anything in that moment. This is a child who had clearly been coached by her parents to say something abhorrent, specifically to me. And, that is a really, really sad state of affairs for where we are. But anti-Semitism has long been an underpinning of the anti-vax movement and anti-vax propaganda. When yellow stars started popping up all over the place, including here in the US, and also abroad in London, for example, as part of the anti-vax propaganda machine, again, I was not surprised, because it's always been there. It has always been there, and I wish I could say otherwise, but I believe it will always be there. And frankly, we're in terms of how it's playing out for me in this moment. I'll give you an example. Aside from the just absolutely horrific emails that have come my way calling me a Nazi and comparing me to Hitler. But one of the things that the folks from the Library Association, right, the Massachusetts Association of Libraries, is trying to promote is reading among kids. I know this is a great thing. They reached out and they said, "Hey, what are you reading this summer?" There's some studies that show the kids that read 4 books over the course of the summer maintain their reading skill. They're better prepared as they go in. They say, "Can you put some books, whatever you're reading, put some books up on social media and encourage kids to do the same?" I'm a parent and I'm pretty vocal about being a mom of young kids as I serve in the Senate. So I said, "Of course, what a great idea." And so, so we worked together, we got posting up, and the number of comments that came back on that Facebook post that suggested that I read Anne Frank's diary or Mein Kampf, and other similar books concerning the Holocaust were just appalling. And this was not a post about having anything to do with vaccination policy or masking or COVID or any of it. It was literally about encouraging kids to read. And the vitriol and horrific anti-Semitic hate that came back my way because of, posting about reading with my kids and and reading in general was really, really difficult. It's really difficult. Um, it's really difficult. And, and I continue to see it in the, so I live in Needham. Needham has had an anti-Semitism problem for the last several years. We've had swastikas at the high school. There was a case of arson at the Chabad house in Needham, another case of arson just a few weeks beforehand in Arlington at that Chabad house. Right, my children were evacuated from their preschool because the preschool is Jewishly affiliated. And they had a bomb scare. This is very, very real. And we've all seen the statistics about how we've seen the statistics, and also we've been living through the experiences of such a terrifying rise of anti-Semitism in our communities. Most recently, I represent the town of Franklin. They had a number of swastikas show up in a bathroom at the high school. And I reached out and I said, I'm not a survivor, but I have a family story. And there's a bill pending about genocide education that the Senate passed last term, but you don't need to wait, right? Our local communities don't need to wait to do robust genocide and Holocaust education. And I will come. I made the offer. I will come and talk with your students, and engage in community with students and parents, teachers, staff, to have these kinds of conversations. Because goodness knows, whoever's posting that kind of vitriol on my Facebook page and drawing those swastikas in the bathroom or on trees outside in North Andover, I mean, it's everywhere. Yeah. Goodness knows I've spent a lot more time thinking about and learning about the history of the Holocaust than any of those folks. And so if I can help to provide education and understanding, then I'll do it. It means something to me. It means something very significant to me to be the first Jewish person to hold this seat. And and my husband is Israeli by birth, and moved to this country in his younger years with his family, of course. And we are very privileged to raise our kids in a strong Jewish community with a strong Jewish identity. And we've had challenging conversations, and our kids are only 5 and 7. It's hard to bring that down to a digestible place. But we have family and friends in Israel, and the 5-year-old even has started reading the headlines in the Boston Globe, and sometimes they see that's something. But they see
we could have a whole program just talking about that.
Yeah, we sure could. Back to the reading post. But they see things. They consume images and stories. I mean, they're, kids are sponges. They suck in every bit of information they can get. And sometimes it's really hard to digest, and it's hard for parents to grapple with how to explain it.
Well, for our audience, I mean, I'm sometimes at a loss for words, and we've had conversations about many of the specific things that you've experienced before. And part of me, I want to acknowledge and sort of, affirm that, you should not have to endure what you have to endure. And yet at the same time, I'm hardly surprised when you share this stuff with me, because, I too sit in a somewhat public space. And certainly, we all have this experience of you post anything on social media about anything and get back crazy anti-Semitic stuff that has nothing to do with the topic at hand. So let alone something that has already been, the fact that you're leading on an issue that has really been taken over in the public space with this kind of like horrific rhetoric. In some ways, it hardly surprises me, and you should not have to endure this. And I also hope for this audience, this is we're talking if we were in a room full of Jewish leaders across Boston, who I hope see there's this element here of, you are someone leading from a Jewish place, leading as a Jewish leader in the public square in a way that most of us don't on a day-to-day basis. And some of us, we step out into that space on individual issues, or we step out into that space in our volunteer time, not my time, but many of the people who are with us today in their volunteer time, for a specific event, a hearing, whatever, but you're out there every single day and you don't get to ignore, as you said, when a synagogue in your district is literally torched in the middle of the night, or when there is literal, as we've been, 7:30 in the morning texting about, a school district that had a Holocaust denial or swastika, you don't get to ignore that, let alone this stuff that's incoming. And so, I just want to affirm and appreciate the kind of like the role that anybody who is Jewish who steps out and takes on public leadership is what you're taking on that we don't have to take on right now. And I don't think we all necessarily realize that on a day-to-day basis, what happens to Jews in public life.
Yeah, thank you, Jeremy. I appreciate that. It is something that, my husband and I talked about, my mom and I talked about, given her prior work in the space. Right, my mom was at the Demjanjuk trials back in the 80s.
Wow.
She did some really significant work. She left that work because neo-Nazis were making death threats against me and my sister. And
Wow.
that reality has continued to perpetuate. But I will say, it's also a sense of, it brings me, look, I ran for office, I certainly didn't anticipate this kind of level of anti-Semitic and frankly misogynistic hate coming my way. But it wasn't a huge surprise when it did. I was the only Jewish person in my primary, and I was also back in 2018, and I was also the only candidate asked about BDS. So it started way back then, but I will say that it not only generates for me a sense of solidarity with fellow members of the Jewish community, both in my district and in the communities right around my district and throughout the Commonwealth and nationally, right? That's part of why when I was asked to join the board of the National Association of Jewish Legislators, I quickly said yes. And I've learned so much from collaborating with Jewish colleagues in state legislatures all across the nation. But it also creates a real sense of solidarity with other people who are persistently persecuted for a whole host of reasons. Some of which are significantly systemic, especially in America. Right? It's my Jewish values are such a huge part of how I became a progressive leader and a progressive champion. And when those moments, the really hurtful, the most heinous moments come and stun me into silence, right? That's why it's so important in those moments when other people can come in and speak for us in moments where we are just so shocked. And also why it is so important for us as racially predominantly white people. I am a white person, right? You and I both are sitting here. Jewish people in America are often perceived wrongly as totally white, but we are in large part a white community, and why it's so important for us who so strongly believe in diversity and equity and fairness, to speak up when persecution happens to other people based on identity.
One of the things that I'm going to move on to other issues, and I don't expect a response to this, but we've only known each other for a couple of years and we're still getting to know each other. And I totally agree with you that predominantly the experience of certainly Jews in America and the narrative and where we've sat in sort of the hierarchy of caste in America has been largely on the side that is called white. And at the same time, many of us are not, and certainly the majority of Jews outside of the United States are not put in that caste category.
Right.
I would say on a personal level, you and I are still getting to know each other. I actually don't necessarily put myself in that all the time in the same complex ways, because as many of our leaders and certainly our council members know, my mother is Mexican American. I self-identify as Mexican American, but as we always say in our family, identify as both Mexican American and presenting white in the American context. And I think that's a larger conversation about Jews present white in an American caste conversation, which we could spend hours unpacking, but we won't, because I definitely share the broader sentiment that you are expressing here today. You did touch on this, and
I had in college.
yeah. So you touched on this. You mentioned your husband, and obviously, you're raising your kids with an Israeli-American connection. You mentioned some questions that come up as a candidate, and you are clearly a leader in the progressive community and a leader in and on behalf of the Jewish community. And so I'm curious, when some of these conversations specifically related to anti-Semitism or Israel that come up in your life come up, is there anything, and I'm saying this like, I know our audience, and I think a lot of people in our audience are curious about, like, how does one talk and struggle with talking about Israel in progressive space? And I don't want to spend the whole rest of our time on that, because there's a whole bunch of other topics we want to get to, but like, if you have any insight you want to offer about that conversation, maybe we'll do that now.
I think I certainly struggle with this. And you and I have talked about this before. And I've had a lot of conversations about this in the last several months, perhaps unsurprisingly, in particular. But I think it's actually really good, especially for those of us who are parents, to model that it's okay to be struggling. I'm really deeply struggling. I've been doing Israeli dancing since I was 5, right? I've traveled to Israel several times. My husband is Israeli. I have family and friends in Israel. And I am ever cognizant of the fact that Israel exists because of millennia of persecution of Jewish people, right? Anti-Jewish hatred is the oldest hatred in the books, right? At the same time, I vehemently oppose so many of Israel's policies. So many of them. And that's a really challenging space. It's a challenging space to be in. But also, I keep coming back to this in so many conversations, right? We have the same dynamic in America,
yeah.
Right? I like, especially during the previous federal administration, I vehemently opposed basically every single thing that came out of the federal government, and yet I still identify as American, and in fact ran for office in the middle of Trump's tenure, and am now, very publicly fighting and achieving change to generate positive change for our society and our communities, a lot of which is centered on combating discrimination, disinformation, the kinds of persecution, systemic oppression that we've discussed at various times throughout this chat. So I certainly don't have any answers other than to kind of embrace the fact that we're all reveling in a bit of confusion here. Not confusion, but conflation and challenge, right? It is challenging. And frankly, to a certain extent, all politics is challenging. None of this is easy or for the faint-hearted.
Thank you. I'm sure people appreciate that you sharing that's how you're thinking about this, and knowing that there are leaders like you having these conversations is something that's of great interest to a lot of us. Vaccine equity, gonna one last thing on this, because I don't want to lose the opportunity to promote this, but like, what can we do as an audience to help advocate and help support your advocacy on vaccine equity?
Well, you can support. I'll put a link into the chat here in a second. I gotta just call it up.
I think a member of your staff is in there, so you don't need to do. We'll throw that in.
Yep, he is putting some links in, I think, about the bill. Thank you, Evan. There are a number of bills that are pending, including both vaccine equity and also the Community Immunity Act. You can go here. I'm going to put a slightly different link. Oops, except I put it just to the panelists. So wait a minute.
We'll take care of it. We'll take care of it.
Know how to use Zoom. There we go. You can click that link and add your name to support either of those bills. I also am and frankly, this also ties back to Jewish values, leading on democracy and election reform. There's my Mail-in Voting Act is still pending in committee. A number of things are moving on mail-in voting in sort of interesting ways because of, in large part because of COVID and because elections keep happening as we go forward. Faster than the legislative process in some instances, but we do have a number of things pending, and so folks can add their names there, and certainly reach out if anybody has any questions about the bill. The Vaccine Equity Now Coalition has been doing some very significant work to push, particularly on the data piece, which we have, we had compliance with, and now we have lost compliance with that legislation. I should add that vaccine equity focused data piece is also part and parcel of the Community Immunity Act, which was an addition we made this second time around filing because of a lot of the lessons that we learned through COVID.
Thank you. Since you brought it up, mail-in voting, and I think a lot of people, it's certainly been my experience that a lot of people are surprised when they learn that our Commonwealth is not one of those states with the most robust ballot access rules. And I'm sort of curious what you think, what you hope actually we can eventually get to as a Commonwealth on voting rights. And to the extent that you have any insight, what's the opposition been, or where is the opposition?
A lot of the opposition is grounded in falsehoods and frankly, voter suppression tactics that we're seeing take hold in many other states. Right. In fact, I believe there's something in the works right now to get a mandatory voter ID ballot question on the ballot in 2022, right here in Massachusetts, right? Lest anyone continue to think that we are a progressive state. We are not. We may vote blue in presidential elections, but that does not say really much of anything about our internal, internal politics and positions. We do not have universal mail-in voting in Massachusetts. We do not even have same-day voter registration in Massachusetts, which is a bill that has been filed session after session after session by Senator Cindy Cream, that has now finally been reported favorably out of committee, and we'll see if that moves along. I certainly support it. We have a lot of pieces. Even when we implemented automatic voter registration, it was done in a way that, in fact, was not what the legislature intended, and it's not the most robust way to do that, to really encourage as many people as possible to vote. We just, the virtue of our September primary date discourages people from voting and engaging because, rents, right, and apartments. And we could have a very long conversation about this, but our primary is the very last in the entire nation, right? There's a reason that more than half the states that hold traditional primaries hold them in the sort of late spring period, right? Late May, early June. But we have failed time and time again to do that. But I continue to file that bill and push for that bill to move the primary date. So, we're not even part of the interstate electronic voter registration system, despite the fact that the legislature mandated that the secretary actually join that system back in 2018. So here we are, coming up on 4 years later, and it still isn't done. And all of that is proven to drastically support voter engagement. Right. And then we can have a whole other conversation about voting behind the wall, right? Voting for people who are incarcerated. But we probably don't have time for that.
Well, and I appreciate us naming and getting into it because it's a very important set of issues that you've been a leader on. And, one of the things for JCRC has been to really embrace the strengthening and protection of democracy as a priority over the last 5 years or so. And I would say for us, it's been, in the last 5 years, become much more central to our agenda, not because it was only a problem in the last 5 years, but because it's been a real wake-up call for us, learning about these things and seeing these problems. We haven't gotten to the place of formally endorsing moving the primaries from September, and I recognize that there are some interesting dynamics around what that's about that are not just about expanding the franchise or making it easier to vote. Although it certainly would make it easier because we wouldn't have to negotiate every 2 years or so to move them so they don't fall on Rosh Hashanah and Yom Kippur, but that's a whole other conversation. But before we do, but we'll move on from that. And just to say, I appreciate your leadership. I know there are like a bunch of questions that we haven't even gotten to yet. There's a question from Bill about what the legislature can do to protect a woman's right to choose under Massachusetts law in case Roe v. Wade is overturned. And also wanted to hear if you have any thoughts about combating gun violence here in Massachusetts.
Yeah. Hi, Bill. Thanks for your question. We passed abortion access legislation last session. We passed it over the governor's veto twice. So we are now, though we would not have been had we not passed that legislation last term, we are now in a place where, at least in Massachusetts, if SCOTUS overturns Roe v. Wade, abortion access will be preserved here in Massachusetts. And that was a Herculean effort by so many people, including in particular my friend and colleague and mentor, Senator Harriet Chandler in the Senate, and so many activists engaging in so many important ways to get that across the finish line. But our work is not done on that at all. In fact, I have a bill called the Pregnant Persons Health Act that strengthens the foundation that we enacted into law last session, right? That ensures that any person who is pregnant, who, by the way, all people who are pregnant right now, no matter age, can make every decision about their pregnancy except the decision to terminate it. That is now not true for people age 16 and 17. That was part of the legislation that made it across the finish line last session. But a 15-year-old is still prohibited from making the decision to terminate their pregnancy on their own, even though they can make a whole host of other decisions on their own while pregnant, including, by the way, the ability to get vaccinated, I might add. But when the pregnancy is over, arguably, that decision-making authority over their own body goes away. It all comes back to the Community Immunity Act at the end of the day in some way. So there are a number of pieces of legislation that are that have been filed, including my Pregnant Persons Health Act, bills on access to medication abortion on college campuses. I mean, there's a slew of bills that are currently pending. Some of them are before a good number of them actually are before the Public Health Committee. So you can, advocate for those particular bills to advance with the Public Health Committee members and particularly the chairs. You can reach out, of course, to your own state senator and representatives to encourage them to support those bills. And to there will never be, or at least I don't envision an end to our work to advance reproductive health and justice. And I do want to call in explicitly that this is, in fact, this is of course about abortion, but it's actually about so much more than abortion. When we start to think about reproductive justice, and a question about whether, when, and how people can decide for themselves to become parents, right? That's also about birth care, right? And so I'm the lead sponsor of a bill to license certified professional midwives. These are the midwives that provide home birth care. And we are one of just a handful of states left that still haven't done that. So we're way behind the 8 ball. And unsurprisingly, perhaps, there's a huge uptick in requests for home birth care in the last year and a half, as people who are pregnant thought, maybe I don't want to go into a hospital in the middle of a global deadly pandemic, right? And not just because of concerns about contracting COVID themselves, but also about resources, right? Hospitals have a limited amount of resources. So there's diaper changing stations, right? And you think about birthing and parenting, right? Becoming pregnant, birthing, and parenting collectively as a reproductive justice mission and movement. Our work is so far from done, right? So far from done. Even when it comes to how our birth certificates are drafted in Massachusetts, about accessing pediatric appointments, all of which are pieces of my legislative portfolio. So plenty more to do.
Unfortunately, we're not going to get to every question that was put in the Q&A. So I'm going to bring us sort of moving towards close, but you did touch on this a little bit. So I hope we'll expand, because there is a question about childcare and affordable childcare. And you were talking about pediatrics, and you were talking about all these other aspects of sort of the intersection of all these issues related to parenting and pregnancy and birth. But, any thoughts? And I guess this, like everything else, as you maybe laughingly put it, brings us back to COVID and vaccination, but COVID has certainly highlighted, Kate makes the observation that COVID has highlighted the need for affordable childcare and the difficulties families face in trying to balance work and family. And, we'll sort of end on this question about what takeaways we can expand on from this period when it comes to childcare and family work-life balance.
I think if you're listening to the realm of politics in general, you've heard certainly over the last several months, maybe a year even at this point, me and Congresswoman Clark and Senator Warren and so many others say childcare is infrastructure. And we have never treated it as such, never. Right? It's why we don't have a robust public early education system. It just doesn't exist. Right? Because our structures were built on this idea that is now supremely outdated, that women's work does not warrant value. And the work of raising children has largely predominantly been women's work over the course of history. And so we have just a tremendous amount of work to do to shore up access to childcare is ridiculously expensive, by the way. I'm a parent, we have 2 kids, they're 19 months apart. We had 2 kids in daycare at the same time, and it's like more than a mortgage payment. It is an insanely expensive space to be in. And we are in the place of privilege where we could afford that, right? Where we could scrape it together and make it happen, right? I was able to still work, but we've seen the impact, in fact, specifically about women in the workforce, drastic reduction of women in the workforce by virtue of COVID, because it was impossible to manage remote school and taking care of kids, particularly in the younger grades, and, take care of your family and also work. You just can't do that. It's impossible to make it all happen. And you have to sleep at some point, which is very important to sleep at some point and eat and do things that are healthy for your body.
I have a friend who says that sleep is overrated, but I don't agree.
I sometimes say that as well, and it usually comes to bite me afterward. But we've seen it. Those of us who are paying attention always knew that this was a problem. And again, this is yet another aspect and facet of COVID that COVID has shown such a bright spotlight onto this, failure of our social structures and our government structures to generate meaningful, robust infrastructure around parenting, right? It is, to me, part of this broader question of reproductive justice. And I might add, the US military actually has effectively public childcare, right? It is part and part. If you're a member of the military, your children have childcare. You don't have to worry about how to figure that out. So if we can do it in that setting, we should be able to do it for everybody.
Thank you. Well, that takes us to the end of our hour, and I want to thank you, Senator Rausch, for your critical work and for joining us today to talk about what you're working on in the State House. You've been a really great friend and a partner, and I have enjoyed our conversations, and I hope that this has been a really great opportunity for more of the leadership of our community to see and to get to know one of the most forceful and effective Jewish progressive voices on Beacon Hill, and to learn more about some of the issues that you're thinking about and trying to take action on. And we will include in our follow-up information about how to learn more about the legislative priorities. Several of these are issues that we have been on board with you, and we will continue to advocate. And for those who are here in this audience, we'll continue to provide tools for how to advocate in support of vaccine equity, for example, and these other issues that we've been talking about. So just thank you again, and I look forward to continued partnership, and I look forward to maybe being with you in that background in the very near future at some other activities and events, and continuing this work. For our audience, our next speaker series event will be Moving Forward in Israel's Mixed Cities on Thursday, August 19th at 12 p.m. Many of people here know that earlier this summer, violence between Jewish and Palestinian citizens of Israel spilled into the streets of what are called its mixed cities. Many feared that this would disturb the fragile connections between the residents of these cities. And based in the mixed city of Lod, the leadership of the Abraham Initiatives has been working for years to build trust between Jews and Palestinians in Israel. And they are leading the way to fight and maintain and strengthen these ties in the wake of recent tensions. We'll have to hear from them about their work for equal and just society in Israel. And we'll include the link and the registration on our website. So thank you all for joining, and thank you again to Senator Rausch for being just a great partner and friend.
Thanks so much for having me, Jeremy. It's a pleasure to be with you.